We observe a minute silence for all the souls we lost. May their gentle souls rest in perfect peace. Thank you. In the course of the speeches, we have the Director General of the Ghana Health Service, Dr. Patrick Kumar Abwaji, join us. Thank you so much, Doc. The Presidential Advisor on Health, Dr. Isian Sari, is also in our midst. Thank you so much, Doc, for coming. We have some ambassadors as well. I see Calibos in the house. The only boss with oneness. I see General Tatia in our midst as well. General, give us a wave. Thank you for supporting this noble cause. Ghana's Morning Show President, the voice of Morning Show, the Chief Operator of Morning Show in Ghana, Kwame Nkrumah Tikesi of OKFM in our midst. Welcome, sir. All right. At this point, we want to give the opportunity to colleagues from the various media houses to ask questions relating to the subject matter. Then it will be addressed. Possibly we'll take it in fives, and we'll address them, then we'll go for the next 5. If you are ready, you can show by hands as we do that, or possibly you can line up quickly, then we'll do that. We're starting. First one, your name, media house, or angle you're coming from.
My name is Bernard Atwar. I'm coming from United Television TV. I am particularly interested in the sustainability of this global development strategy. So, how do we do the given achievements? Yes. How do we do sustainability? So that it will not be used as just a tool. Thank you.
Yes. Yes, sir.
All right. My name is Daniel Ogudako from GNA. Okay, so I am particularly interested in the solution-oriented approach, where we will have to do the prevention rather than waiting for people to get into the situation before we help them. What are you putting in place to make sure that we prevent people from getting that situation, that kidney issue? Thank you very much.
Any other? Yes, sir. Yes, sir.
My name is Ebenezer with a daily guide. Quick one to Dr. Da Costa. If you look at the sustainability approach that you made mention of, the preventive and promotional efforts that you've already started, I'm looking at the kind of stakeholders you have here. How have you engaged others? There are other stakeholders. Are we looking at the school? How widespread are we going to deal with other stakeholders to prevent people from getting the disease, or getting infected with their kidneys? Thank you.
Good afternoon. My name is Joseph Udumo. I write for a different paper. So what I'm looking at ECOWAS. What are your collaboration with the ECOWAS, like Nigerians, and what are you treating our kidneys for collaboration and partnership with ECOWAS regions?
ECOWAS?
Yes.
How we are collaborating with ECOWAS?
Yeah, with
kidney?
Yeah, partnership. Yeah.
Any other, possibly maybe the last one for the first batch?
thank you. I think the sustainability, I think I made mention of the fact that if we do internal arrangements, I think we shouldn't have any problem. At the end of the day, we need about 57 million. And this 57 million can be found within our budget. There is no problem about sustainability. And we even projected it to 10 years because the source of funding for the NHIA is actually NHIA. So as long as taxes are performing, and let me at this point say that from 2016 till now, the scheme has actually grown by 6 folds. So we've expanded by 6 folds. So what this means is that we add 2 billion to our budget almost every year. And that is why I told you that our 2024 budget was 6.8 billion. It's moving to about 6.8 point something billion. Normally half of that is for claims. As we speak now, we are in November. Claims payments, the budget for the claims is still being underutilized because claims are, we paid all claims. We paid all claims and it's amounting to about 2 point something billion. So it's not even reached 3 billion. So it means we even still have more funds from our claim budget. So what this means is that we've done the modeling and we will be able to sustain it without any problem. The additional 1.3 billion that will be coming in, if you take out 57 million yearly, it's still sustainable over many years. So I think the question of sustainability should not be a problem at all. And that's why we have all these experts helping. We've done the modeling, and that is what I've actually presented to you. It is sustainable over many years. We know the prevalence as well, so there shouldn't be any problem. Yes, the promotive preventive. I think I agree with you. That is the best approach in actually reducing our cost burden. So that is why we have introduced the promotive preventive as part of our benefit package. Now, for our 20-year history, it has been curative. Curative means that you have to be sick before you go to the hospital. Now we are saying that we want to prevent the diseases. So we are introducing the annual health check, where Ghanaians are being given the opportunity to visit any health facility of their choice on their month of birth to do simple sugar, blood pressure, then body mass index. And again, we have just launched our e-health, our telehealth. So at the comfort of your home, you can now see a doctor. And education on all these are going to be intensified across the country in such a way that Ghanaians will know how to use our telehealth and to use the new innovations that we have introduced on board. So on this, we believe that on a long term, our cost burden will even come down. ECOWAS. Okay, so this scheme is for our members. It's for our members. So that is what I will say. Thank you.
Do we have any other? Yes, sir.
Thank you, Doc. I have 2 short questions for you. In view of what you want to do for analysis and other things, do you suggest that the premium is each at the set that we can cover the cost of moving? Because it's not about only kidney, but maybe prostate and other diseases. So you take that there's many products now for a premium. And my second question, now before you came in, we had stories of indebtedness, mismanagement, all kinds of things. Would you say that you have people expectations and name all these limitations and great at the back so that you are doing something that is so important? Because we used to hear some NHI was ICU, doesn't tell you this, because the story was not very good.
Yes.
Good afternoon. My name is Sarah Adenkwe, Constable TV3. So please, I would like to find out The number of patients estimated to benefit from this particular package are those who are seeking alternative options like the herbal medicines for care for their renal disease inclusive. And I also want to find out specifically how many of the facilities are going to enroll this, and have they received part payment of the money needed for the initial start, or there is a timeline for them to bring the money? Thank you.
As one is also asking whether you can just walk to any facility at all for treatment.
Okay, thank you. So I think the first one is on the premium. You see, this government is doing something wonderful, and I'm going to explain to you. You see, using digital means, especially using the Ghana card, and also with the expansion that is happening, what this means is that more people are being roped in. And our biggest problem is the informal sector when it comes to the NHI, collection of the premiums and others. But once we are digitalizing and a lot more people are paying taxes and everything, our budget will continue to increase. So I'm even looking at a point where most of the claims are by direct payments, a direct and indirect payment, but by obviously not the premium type, but where we are able to collect it by our taxes as we are doing. So, and the premium is about less than 3% on our budget. So I think in that effect, I think we should just concentrate on how the digitalization will rope in more money for the country in such a way that the NHIS will also get what they want. Then, inclusion of other diseases. Was that the question? Okay. So, if you look at it carefully, this year, or since 2017, we have actually added some complex diseases on our NHIS benefit package. And we've been able to afford it without any problem. Childhood cancer, the 4 childhood cancers, sickle cell, recently in collaboration with Roche, Herceptin for breast cancer. So we are doing a lot. But again, Oliver will continue to ask for more. So people will continue to advocate that we add more. But we'll take it stepwise and look at it and see if obviously we will be able to do the modeling and see which ones to add and which ones we have to obviously dial up and add later. But at the moment, what we have is what we have modeled, and we believe that we will be able to fund this without any problem. Sarah, what was your question?
My question has to do with those using the alternative methods, herbal medicine. Are they all factored in the benefit package? And also, how many facilities are we looking at? Have there been initial payment to the facilities, or there is a scheduled timeline?
Okay, so thank you. I mean, NHI do not cover alternative medicine. That's it's not part of our benefit package. In terms of the facilities, for now, when we did the assessment, we do have about 40 facilities. But what we're going to do is for our QA to work hand in hand with them. That is why those 40 facilities are here. So this is why we're dialoguing. So across the country, it will be open to these facilities. But more facilities can also be added when we have credentialed them. The fact is, anytime we do have the way we do our things, unless we assess you and we credential you cannot be part of us. So more facilities, I believe, will apply to be part of us, and we will assess those facilities accordingly.
Has there been an initial payment? Have we already paid some?
No, we added it to our benefit package, so they know how to claim. Now the e-claim system, so once they file it monthly and we pay, so they shouldn't. But let me say that, you see, even the pilot that we did, like I told you, we still have money with the facilities. We did global budgets. We gave them a global budget to spend. So we still have money with the facilities, and the facilities are here, they'll bear me out. So again, that's why I agree with the man from Daily Guide. The NHIS is now on it. It's very solid. It's very solid. And I think for our 20-year history, it is at its best. And it's all because government is giving us the money. Because at the end of the day, in 2016, we had a debt of about 1.2 billion. As we speak, we have paid all the debt to the extent that we are begging facilities to submit claims. Just when I came here, I looked on my portal. We only have about 100 million to pay. Normally, our payment is between 150 and 200. And I've told the facilities to bring the claim so that we have money, then we pay. So it is at its best. So the NHIS is back. And I think everyone here in Ghanaians should support us, because at the end of the day, it is your support that will make us succeed or not. So thank you.
Yes, sir.
I'm going to miss out on my work with TV and my question is a direct one to Kolebu and Overlordship Teaching Hospital. During the pilot, everything was fine, I guess.
Please come here. The camera's out.
Okay. It's a direct question to Kolebu and Kat Overlordship Teaching Hospital. The piloting, we are told that everything was good. So we are now moving full scale 1st December. Are you ready for the 1st December full scale rollout? That people will not come and be sitting there and they will say that the machines are not ready, those who are there are not yet out, so they have to go, and then the president for the union will be appealing to you people that, oh please, ensure that everybody is treated, ensure that everybody is treated. Are you ready for 1st December full scale?
This one straight to the word.
Right, thank you very much for that question. Straight to the point. So you might have noticed that Kolebu recently inaugurated the Center for Urology and Nephrology. And that nephrology aspect has to do with kidney care. And that is exactly where we do the dialysis. And then I think Chief in his address mentioned that 30 machines have been earmarked for that. As we speak now, we have 7 of them installed, ready, and they're functioning. But that's not the only dialysis machine we have. We do have a cabin, I think the as the president of the Renal Association. We have a cabin which has about 10 to 15 machines that are not operating. So yes, we do envisage that there's going to be maybe some influx, but I think we are prepared for it. Of course, in every policy there will be teething problems, but we don't think we're going to do the whole looking at what we have in place. And the 23 machines that are transport, if they are cleared and then we add as well. Then we will talk about elongating the lifespan of the machine, because then you're not going to use the same machine 24/7. You will allow some of them to rest so that people will have options. I mean, not the same machine, and by so you'll be able to perform proper maintenance and be able to increase the longevity of the machine. So yes, the simpler answer to that is that yes, we do envisage that there will be teething problems, of course, for every policy. But in terms of capacity, in terms of the human resources, we certainly are ready for that. Thank you.
All right, Kolebu is ready. Confirm us, are you ready?
Thank you very much. We were one of the facilities that piloted the
the free dialysis, and the piloting went well. And we have sat down with the renal unit. Once the announcement was made, we had to strategize because we knew that there was going to be an increase in the numbers, and we are ready to take on the increase. We cannot predict, but I can only model. We know that the 19 to 59 year age brackets, therefore they are actually more than the 18 and below and 60 and above. What we are also doing in confirmation is that we are acquiring more machines. Recently we had a donation from the Ghana Airports Company. We are also getting new machines from our IGF, and we've also refurbished our dialysis center. We have another center in the family medicine unit, which can actually take 24 machines. And we are planning to equip this place. So we are ready. We are making sure that in terms of staff, we are also ensuring that the number of people that we need so that we can offer an efficient service are also on site. So we are doing rearrangements of the duty rosters to ensure that we can take in the numbers that are coming. And we are doing it in such a way that it will be sustainable. So I'll conclude by saying that after the pilot, we have gained experience and we are ready for the rollout. Thank you very much.
Thank you, Doc. One of the ambassadors of the scheme on this particular project is here. Mr. Chris Atto is here. Mr. Chris Atto will give us a word on this project. Let's welcome Mr. Chris Atto.
Good afternoon, Ghana. Good afternoon, His Excellency, and of course, the team up there, Doctor. Great work. Good afternoon, Ghana. Let me start by very quickly saying that I want to commend the good work that's happening here. And in case you may not be aware of what's happening, I'll give you a quick example. I have a big movie premiering on the 29th of November. And in order for you to attend anything like that, you need good health. Something we take for granted, you need good health. Ghana is moving forward in many ways, and we can't be left behind. There are several people who have suffered from kidney disease. People who have died for reasons that they didn't have to. And so when individuals, establishments, institutions take it into their hands to make sure that Ghana is okay, however we are going to do it, it is commendable. And to those who are already suffering from this disease, we want you to know that we are here for you. I'm encouraging you in a small way. I often said very quickly, everybody says, sometimes I'm having a bad day, I'm having a bad day. There's no such thing as a bad day, because if there is, try missing one. We are all here, we're all alive. And while we all have a responsibility. In my own small way, the Chris Atto Foundation is responsible for taking care of people and reminding the fellow Ghanaians that we're one. And so, good doctor, I would like to say it right now without taking too much of the time, that we're commending you, we're supporting you, and looking forward to the space and what we can also do to slowly change things and make things better in Ghana. Thank you.
Thank you. Ghana's morning show president. Ghana Wafa Kwame Nkrumah Tinkesia Wafa.
For the sake of the cameras, I think I should also speak English. Mine is a recommendation to the organizers and those team that put these ideas together to make it a reality. And I have the assurance that they will do proper maintenance culture so that we don't wake up in any of the mornings or evenings to hear that, oh, these machines that we bought are so dysfunctional that people are not even allowed to go and then have access to the facility. So we thank you for this gesture of making the dialysis machines a reality for people to access to it. Thank you. The American said, you go on my basso. The son said, they are presented. You don't want the high end and offer a fatu air. Now, you call it 3 times a week. Just we need you. And this is what you have for ever. It's up there, you know, every month that burden on us will be so easy. It had 34 in us.
Carlos and Chelsea. Dinner.
Good afternoon, ladies and gentlemen. Good afternoon to the board. Thank you for talk. We are highly elated to be here to witness today. And also witnessing today simply means there's hope for the future. I pray this will continue, and I also pray we don't politicize this. Here, the politics really want. Now, actually, on one side. We should buy now, bet you on one side. Finding a dialysis center is so difficult in certain countries. But we are having it for our mother Ghana country, Ghana again. We should really rally behind this and help this be a milestone that we all benefit from. Not that we will also go and be those of our community, but then those we know that these facilities can help, we all help to support it. Thank you so much.
My brother has said it all. You said it all, friends. I don't like it. Yes, in fact, I am not beautiful initiatives, and I think that this is one thing that we support our country. A lot of people are going through a lot. In terms of payment, it's very expensive. So if government sees the need to support this thing for it to be rolling, I think that's a big focus. So I'm here to pledge my support, to do what I can to let people know about it, and also to conscientize people about how well they can take care of themselves so that tomorrow the work is done. So we are here to support and also to pledge that we go all out to make it well and successful. Thank you.
The best Christmas package for the year. What would you have used to pay for your treatment? Use that on a good time with your family. Distinguished ladies and gentlemen, as we're about to wrap up, I call on the CEO to give the final remarks before we meet Dr. Da Costa Abuti.
So just to say thank you so much for coming, and we want you to support us. It is not the work of only the NHI, it's the work of the media as well. And like Calibor said, please let us not politicize this. We've been very professional on this dialysis issue. At the end of the day, dialysis do not know colors. They do not know NDC, MPP, CPP, or any of the political parties. So please help us in educating our population. Help us, because we cannot do this alone unless you, the media, helps us to achieve what we